Hello and good evening to everyone, or afternoon, wherever you are in the world. Today, I have the great pleasure of speaking to another medic about COVID 19, censorship, all that is happening. He's from the side of the world with the USA, and I'm fascinated to hear what he has to say. And so, I hope you're going to enjoy this as much as me. And so I'll add into the stream here. Baba, how are you at the moment? Great to hear you. You're muted at the moment, but yes, great to have you here.
Thank you for inviting me, Dr. McMillan. I really appreciate your time and miss speaking with you more regularly.
Yeah, so just for everybody's awareness, Baba and I were on LinkedIn, and we sadly were both censored for, I guess, saying misinformation. I apologize profusely to LinkedIn for anything that I have said that would upset them. That was not intentional, I can guarantee you. And so I've got a chance to get back in contact with him. And I thought, what a great conversation. But let's just start with some basic stuff, Baba. Tell us a little bit about yourself.
Well, I've been in practice now for 22 years. I'm an internist in Pennsylvania region, and I've had quite a diverse background. Actually, LinkedIn is a great place to check me out to see everything, but I've had experience in healthcare administration, in practice. I still am in practice. I'm actually at one of my own centers right now. We do IV nutrient therapy like vitamin C drips and other innovative integrative treatments. And I also have a very strong background in technology, worked at a large health system doing that, as well as a stint at Pfizer.
Really?
Oh, yes. So I've been very fortunate. I've been had a really great career, up until now. And now I'm kind of more of an entrepreneur, although I still practice. My clinical practice is very minimal now, maybe 5 to 10 days a month.
Excellent. And so, in terms of your transition from, say, the hospital medicine to integrative medicine, what made you do that?
Oh man, I have to attribute it to my wife. Actually, she is much smarter than I am. So she and I both, we kind of went through undergraduate and graduate training together in residency. And we both, as everybody, as most physicians in the US in 2010, we were all very frustrated, with the way healthcare system was going and, the outcomes that our patients were getting. We were trying very, very hard to improve the care, but really nobody was getting better. We were discharging patients on everything that they should have been on according to the guidelines. And they'd be back, 2 weeks later, 4 weeks later, 6 months later, with the same thing or even worse. And it was very frustrating. We were very close to really being totally burnt out. So she's the one who actually discovered integrative medicine in her journey to try to improve the care that we offer to patients. And the way I like to think about it for people that don't know what integrative medicine is, it's a root cause approach, to clinical therapies. Whereas what we were doing as allopathic physicians was really putting medications on everything. Medications that made us a lot of money and made our system a lot of money, but didn't really do much for the patients because it never addressed the root cause. They would be on these medications forever. And so the discovery of integrative medicine, which actually is a amalgamation of all evidence-based medical practice. So, allopathic medicine is a part of integrative medicine, as is osteopathic, as is acupuncture, as is yoga, as is, massage therapy, anything that has evidence is something that we would use in an integrative approach to a patient.
Wow, that's fascinating. And one of the things that you had mentioned was that your wife actually got, quite a lot of attention on YouTube arguing about masks and mask mandates. Is that right?
Well, she's a fervent advocate for children.
Wow.
We have 3 boys ourselves. And I always say, she is the greatest doctor on earth.
Wow, what a tremendous. So let's hear her a little bit before we get into this bit. I've got this here, and I thought I'd add it in. This is your wife on YouTube. So let's hear what she has to say.
There may not be any sound.
Oops. Sorry, Barbara. I think that what happened there is I don't think I had the sound on it. That was great. I was hearing it, but I couldn't get. No, listen. Oh, so let me just put it into context for you here that weren't listening. Is that in effect she was taking on the school board about the masking of children in school, and she took a very strong stance that they shouldn't be masked. Did she get into trouble for it?
Oh my gosh, big time. We got all kinds of inquiries. So many people complained to our medical board, to the hospital that she was on staff at, and we fought every single one and we won every single case. Our medical board basically came back and said, "This is ridiculous. No, there's no reason why you should be getting any of this attention for citing evidence-based." Everything that we cited was from the CDC. And the hospital, unfortunately, we did not want to butt heads with them, so she just resigned from the medical staff, which is fine
Wow.
because she was done, with inpatient medicine anyway, just because she was tired of doing the wrong thing for patients.
So let's just come into that, Barbara, because you were involved in terms of managing patients who had COVID-19 in the hospital setting initially. How
Yes.
did you feel about that with this kind of thinking on integrative medicine?
Well, first of all, I mean, I'll never forget. I was at Pfizer actually, and when COVID came forward, and I realized after being there a year that I really missed clinical practice, and I didn't really enjoy my time at Pfizer. I mean, it was well. Let me just say it differently. It was an excellent experience. I learned so much about the healthcare system, but the work that I was doing was not really fulfilling. And when COVID really hit, I really felt the itch to go back and take care of patients again. So I left my work at Pfizer and went right back into practice full time, basically, and right at the beginning of COVID. So I was at a number of hospitals helping out. I mean, people like myself were in high demand because, as you know, there was a shortage and people were getting sick, and so I was actually fortunate to be at quite a number of hospitals right during that first 6 months of COVID. So I got to experience like different environments and different regions and how COVID was affecting, different populations, obviously with all the different hospitals I was at. And, what I was amazed at, this was the first time that I saw in a hospital order set, a vitamin, aside from the usual like B12 and those things, but our COVID order set at Central State Hospital, which I'm very proud of them, they had vitamin C, which was amazing.
Mm,
And at that time, the evidence was not as much as it is now, but the evidence, even at that time, showed that high dose vitamin C was effective in COVID.
yeah.
So it was on the order set, but we weren't allowed to order it. Only the ID doctors, the infectious disease doctors, were permitted to order it. But still, I think that was a great development, and it just shows how the pandemic really changed the way we do everything in medicine.
Wow. And so how did you feel then? Because one of the drugs that I could never get my head around was remdesivir.
Yeah,
How did you feel when this was
yeah.
being pushed or promoted in the context
Well,
of
yeah. Unfortunately, I prescribed it to every single patient, and the reason was I didn't know. We thought that the evidence that we were given was that it's working, and so for that first 2 or 3 months, we gave it to so many patients, and very few of them had great outcomes. I mean, most people recovered, but unfortunately, a lot of people didn't. A lot of people didn't make it. And sadly, I believe that the remdesivir that I was prescribing was probably contributing to the demise of a lot of patients and the morbidity of a lot of other patients. Um,
well, and this raises a big question. So I can ask you based on your pharmaceutical interest.
yeah,
You were working in the pharmaceutical industry.
yes,
Truthfully, as an industry, it has to be concerned about making money off drugs, and it has to be based around evidence-based medicine. How do you feel now after what you have seen, especially around remdesivir
yeah.
and the impact of the pharmaceutical industry?
Well, as I said, I mean, I loved my time at Pfizer and in proper pharmaceuticals. I mean, as a practitioner, you deal with pharmaceutical industry your entire practice. I mean, you're speaking to reps all the time. Sometimes you're speaking to different levels of leadership about new products and developments. And my role at Pfizer was a pretty cool job. I was a U.S. enterprise medical lead, which was a new position. And the nice thing about that role was that I got to speak with a whole lot of different, Pfizer clients or customers, which included the elites, like the Yales and the Harvards and the Kaisers and all the greatest health systems in the U.S., as well as people that were on the other side, on the clinical side, just taking care of patients. And so my time there, what I realized was that I didn't understand before I started working there how important and how much influence the pharmaceutical industry had on everything that was happening in the hospital. And as in my role, one of my charges was to help our hospital clients and our customers to take better care of patients. I didn't sell drugs. I mean, from a working at Pfizer, yes, I was selling drugs, but I never spoke about drugs with anybody. Very rarely. And if somebody asked me, I did, but I spoke about diseases. And so for that purpose, for that reason is why I joined. I mean, I was very impressed that they're taking an integrative doctor. My job as an integrative doctor is to get you off your medications, not put you on them. And so they were very forward thinking in that, and they knew that was my kind of philosophy of care. And they still hired me and took me in on the team. And so in my time working with a lot of these medical systems, I learned very quickly that how much influence the pharmaceutical industry has on bedside, policies and protocols for care, because I was the one that was trying to develop those, with them. And we did some very good work there, but unfortunately, or fortunately, either way, however you want to think of it, my time there was pretty short. But when I realized that I could do a lot better and I could do a lot more work, back at the bedside and back in the administration, is when I decided to leave.
And so what I'm interested in is, because I think that one of the challenges that the pharmaceutical industry has now is that after the pandemic, there is so much negative press around Big Pharma and the influence that Big Pharma has. This is what I'm trying to get at is, yes, it does have influence, but it does do some good as well on the other side. And that's what you seem to be emphasizing.
Well, I mean, I want to focus on the good, right? I mean, there's no point in criticizing, unless it's going to be constructive, right? There's believe me, there's lots of constructive criticism that I can offer, but there's also, a lot of good things about pharma. I mean, for example, Pfizer, there are over 150 very, very commonly used medications that we need in the hospital that come from Pfizer. And when patients are dying or at the end of their life is when most of these medications are very useful. But sadly, the ambulatory and kind of non-inpatient setting, a lot of the therapies that we offer in all pharmaceutical companies is probably not needed. There's other approaches and there's other ways to handle medical disease, and pharmaceuticals are just one tool. I think sadly the pharmaceutical industry, criticized or not, kind of hints that that's the only tool. And I think that's unfortunate for our clinical, especially our young clinical clinicians, because and me included, I really didn't consider any other therapies. And I'll give you a quick example. In heart attack, which is a very most common disease, in America, we focus on beta blockers and ACE inhibitors, and these are good drugs. I mean, especially if you're having a heart attack. But why don't we talk about cardiac rehab? Cardiac rehab has a 50% reduction in mortality, as opposed to statins, for example, or beta blockers, which have a 20% or a 25% reduction in mortality. We're doubling the mortality with cardiac rehab, but we rarely talk about it.
Yeah.
Small example of what I learned.
I'll tell you one interesting thing that I saw as well in the pandemic was the strange pattern of discrediting very important aspects of just basic health. One of them was vitamin D, which got tremendously criticized in COVID 19 about it doesn't work for COVID. And I'm thinking to myself, where 86% of the population is vitamin D deficient, come on, whether or not it's relevant, you should encourage everyone to take good doses of vitamin D. It's
Yeah.
that kind of thing that had to be influenced, in my view, from the pharmaceutical industry and the lobbying there. That gets me concerned. How can they rebuild their reputation after this what we've been seeing over the past few years?
Yes, sadly, I mean, the way the system is set up, it's very difficult to directly ascribe some of those bad recommendations to pharma. I mean, because who at the end of the day is making those recommendations? It's physicians like you and me. We are employees, of these companies, and we are the ones that get hit first with any criticism because they don't have medical disease, they don't have medical licenses to practice. We're the ones that are saying these making these claims. Yes, it's on probably on behalf of the pharmaceutical company, but then number two is that what are the ramifications? What are the sanctions that we can hit any of these companies or these individuals especially with making these kinds of claims? Like, there are none. There's no penalty for saying the wrong thing. And look at how many people went on the news, the national and local news, even in the medical environment itself. Clearly we made so many errors, and because it was at a population level, what is the penalty for those of us that knew that we were making the wrong claims and still did it? Because there are a lot of those people, unfortunately.
And so yeah, it leads us into the pandemic. If you were to pick the biggest error that you saw in the pandemic, what would it be?
From the clinician's perspective, it was not looking at the data ourselves, and I was guilty of that myself. The first 2 or 3 months of COVID, I just went along with the guidelines and with whatever the recommendations were. That's why I was giving people remdesivir, and that's why I wasn't giving them vitamin C and wasn't giving them, vitamin D as well. And so that was a huge mistake. But the thing is, that's what we're trained to do. We're trained to comply. When you get an A in your math class, it's not because you're very smart. It's because you complied with whatever they were training you and teaching you to do in that part, for that test. And so we are very good compliers, and that's where as professionals, physicians especially, and I'm going to just say everybody, nurses, pharmacists, we are all experts in compliance, more so than any other professional industry, like accountants or lawyers, especially. Those guys are thinking, much
Mhm.
more than we are. We are just complying. We're following the recommendations. Oh, the CDC says this. Oh, the FDA says this. Oh, the American Society of whatever says that. Let's just do that. We're not going to even look at it. But and sadly, that's what we always have done. I rarely looked at the evidence when I prescribed or when I followed a recommendation from a national body. But this entire the pandemic, for me, and I think for a lot of people, made me start questioning my own practice. Is that why was I just following recommendations blindly without looking at without looking at the recommendations with a critical eye and trying to see how those recommenders, those quote unquote experts, came up with their recommendations. So it made me a much better clinician, and it also changed the way I practice in a profound way.
It's an important point here, and it's one that I tend to have to answer whenever I'm responding on, say, social media. A lot of people are very upset with the medical fraternity for what they see as errors in what happened. And their view is that if there was a problem, the medical fraternity would have picked it up and said something about it. And I'm saying it doesn't work like that because most clinicians, as you say, what they're very good at is complying with what we call evidence based medicine. And anything that shakes that shakes the foundation of medicine. That's why they go along. They don't actually think. Is that true?
That's 100% true. And I'll tell you, the evidence sometimes is not evidence. The vast majority, I would say 50% or more, probably 70% of the evidence, is commercials. These are commercials that I funded, as a executive at Pfizer, to advance our agenda, and it was well intended, because we believe through our own research and that a lot of our medications and a lot of our, as a Pfizer person, at the time, worked, and so the funding that we provided and all of the initiatives that we took were well intentioned. But I think in the case of COVID and COVID treatments and the COVID vaccine itself, we took a detour somehow. We did not do the evidence and the research that we needed to do before prescribing this at a mass level, at a population level. And I think that's clear now.
How could that? This is I try and reflect on it and try and think of does how does the medical fraternity explain this to the public in the context of if an error was made, if a major error was made and harm was done, how can they justify not saying anything? This is part of the problem.
Huge problem. And I am a bit of a conspiracy theorist, I will tell you right now. But I'll tell you though that it took 12 years for the medical community to start washing their hands, because those people were conspiracy theorists too.
Yes.
For 12 years, we did not wash our hands, and we did not put those guidelines and protocols into place because it was ridiculous at the time. And it took 12 years before those conspiracy theorists finally were vindicated, right? So I'm actually proud to be a misinformationist. I am proud to be a conspiracy theorist. I'm very happy for anyone to come to me and show me the data, show me the evidence that proves that what I'm claiming or what I see in the data is wrong. Because listen, I wish that what we're complaining, especially with COVID, was true. But it's just not in my practice. I mean, having taken care of thousands of COVID patients now in 3 years, we have seen the opposite of a lot of the claims that were being made by our governing bodies and our regulators.
Wow. So what was it? And this is an interesting question. So you are going along as a complier early in the pandemic. What made you shift your narrative? Was there a specific moment?
Oh, yes. When I realized, so I remember on LinkedIn, actually, when I started on COVID, and I was in my LinkedIn, I probably had 3,000 or 4,000, followers or connections. And I started using LinkedIn because before that, I never posted anything. I mean, here and there, I might it was just like a fun thing that every now and then I would try. But I started asking lots of questions to experts, and social media was wonderful for that. And I was doing my own calculations, like when people on TV were saying that there's going to be a 50% reduction, mortality, and then they revised it to 15%, then they revised it to 5%. I had myself come up with a 0.5%, mortality for this early, within a couple of weeks. And if a fool like me, can do that, because that's, as you probably know, the mortality is 0.17%. Worldwide, internationally, and that was shown by so many experts in epidemiology early, and so when I started communicating that on LinkedIn, especially, I went from a couple of thousand followers and connections to over 50,000, and so we developed a really nice community of people, and obviously you were a part of. I would never have met you, Philip, if I didn't do that. And as you know, what followed, was a lot of censorship. I was banned multiple times, as you were as well, for just sharing what I saw in my practice and sharing my thoughts. And never did I make a claim. I'm not a researcher. At that time I wasn't. So I just shared, what I was seeing and kind of what I was thinking, and I was censored for that.
I'm gonna show you an image here, Barbara, that I've captured because I found it interesting. And as I said, LinkedIn as well. I was there. It was an important part of the communication and the science. But here is an image of this is taken from the what do you call it? LinkedIn usage and revenue statistics 2023. And so it was sharing information about the key statistic. It's about 14.5 billion generation. But just look at this here. This is a chart about LinkedIn's annual revenue 2010 to 2022. In the pandemic, at this point, quarter four 2021, it was 8633 million revenue in that quarter.
Wow.
When they started the censorship, because they were peaking, they took a 20% hit almost in order to clear the platform of clinicians, of scientists who were not following the narrative. They still haven't recovered up to quarter four 2022. What would make a company do that?
I think they were being compensated in some other way. I mean, that's the only thing that makes any sense. If they're going to serve their shareholders, right? I mean, that's about the time when I was banned. It was quarter three, actually, I believe. And to be frank with you, that was one of the best things that ever happened to me because I kind of got my life back. But, and again, I'm a conspiracy theorist, but I think if you examine the World Economic Forum and the policy, the Great Reset, which is, that was a conspiracy theory, by the way, in 2015, when people were asking about it. Klaus Schwab said, "Oh, there's no such thing as Great Reset," and then magically 2020 he releases a book entitled The Great Reset. And so I think that the World Economic Forum has some policies that are in support or that are in lockstep with a lot of the things that have happened since 2020. Beginning with the pandemic and then the financial collapse as well as now the Ukraine war. All of these things were predicted by a lot of experts back then that this is what's going to happen. And now we are at a point where we're starting to have food shortages. Do you think it's a coincidence that over 1,900 food plants in America have been either burnt down or destroyed? I mean, how does that happen in 2 years? Right. And these are all accidents, right? I mean, random fires or, random accidents that have destroyed these plants, these food plants. But they're facts. These are, you can't make this stuff up.
And so it raises then a big issue with regards to where the pandemic is. And I mean, you're now able to speak about one of the big areas of what was considered to be misinformation, which is whether or not this was a lab leak. Very early in the pandemic, there was, you couldn't say it, even if you thought it. But now that there is a lot of evidence that clearly points towards that from multiple sources, even though it hasn't been formally confirmed, it raises the question, what else then is the next big conspiracy? Do you know? And careful what you say. Don't get me into trouble now.
Well, I'll just tell you what the Great Reset, says, because basically I think we're following that narrative. I mean, the Great Reset said that the best way to institute, global change in a system is a pandemic. And is it a coincidence that in September of 2019 there was event 21 or event 31 at Johns Hopkins where they just so happened to simulate a global pandemic with a coronavirus, and then the financial shutdown that happened after that, lockdowns. I mean, this was all simulated. I think earlier this year, I have not seen any literature on it though, but I understand that there was a global. Yes, sorry about that. There was a global simulation for a financial meltdown, a currency change. So I mean, that's fact.
Yes.
I have not seen the after. They usually publish the results of the simulation. I have not seen that yet. But I think that that's probably it's already happening. I mean, in the U.S., we're seeing record lows in our different markets. And then the food shortages again. I mean, we're in America. We're not really seeing them yet, but I think across the world, in Africa especially, what's happening in Ukraine. Ukraine is as you probably know, huge supplier of food and wheat, and basic food stuffs, to the entire world, especially that region. And I think we're starting to see, death from hunger and, unfortunate um, effects of food shortages. So
Yeah.
that's what I believe.
And it raises something that I'm going to touch on now, because I think that one of the big challenges we have at the moment is that the powers that be want the pandemic to be over. Okay. And as far as everyone is concerned, Omicron is nothing and we can just move on.
Right.
Any thoughts about that?
Well, May 11th, right? That's our official end of the pandemic, isn't it? In the U.S. at
Mm,
least. I think President Biden is going to sign the whatever order, executive order, or whatever it is that ends the pandemic officially. But how many billions did we spend? On I don't even know, hundreds of billions, of dollars on the U.S. preparation and management of the quote unquote pandemic, right? So Omicron, as you know, is a big nothing burger. I mean, from the moment from the moment it was discovered, it was really very, very few people had serious morbidity from Omicron. But I'm sorry, I'm just looking at the timer. Yeah.
mm.
So I think we probably could have declared the pandemic over last summer when President Biden in an interview on national TV said that, oh, there's no more COVID, but yet here we are a year later still funding it.
So let me ask you a hard question with that then.
Yeah.
So the pandemic is apparently over, Omicron is still circulating, and we have probably the highest amount of excess mortality
Yeah.
at this point.
Yes.
This is where I think people are missing the point. And I'm raising this issue because this is my worry now from a
Yeah.
clinical perspective. I think that, as I've always said, severe COVID 19 is a viral mediated autoimmune disease. Almost all the drugs we use are immune suppressants.
Correct.
Now, if that's the case and the population has been primed, is Omicron actually as benign as we are assuming?
That's a great question. Unfortunately, only time will tell. Um, we have seen. I have my own friends, patients, colleagues, family members, that were fairly robust. I've had 7 family members. I have a very large family, but I've had 7 family members die from either COVID-19 or some related COVID-mediated, primary condition. And obviously, so many others have been touched by COVID-19 in one way or another. But yeah, I mean, I think that the global immunity of our people all around has been affected by not only COVID but the vaccination as well.
And this is a big point, and I don't even know if we can speak about this properly yet.
Yeah.
I usually, when I'm referring to it, speak of an elephant, the elephant in the room. But we need to answer, and a part of my drive, the reason why I keep talking, is because I think that if the scientific and medical community do not grasp this point about autoimmunity, we have no chance of mitigating what could be an absolute disaster in the near term. Am I just worried for nothing?
Absolutely not. You hit it right on the head. I mean, we have an immunological emergency, and I'll tell you, in our practice, we have become immunologists in many ways, especially in an integrative practice. Because what's happened, and if you speak to integrative practitioners in general, when we started in 2014, there were about 1,000 integrative practitioners. That
Mm,
number is probably over 10,000 now. I haven't checked the latest numbers, because people are realizing, that there's a huge need. Our practice in our community, again, this is my wife's practice primarily, has become the place to send patients when you don't know what is going on with them at all, when you have no clue. You've
mhm.
tried various things and nothing is helping them. A lot of them get extremely debilitated. and again, I'm talking about vaccine injury patients, and are unable to function. They close their businesses, they kind of lock their front door, they have to stay home in many ways for a lot of these patients. And they're really grasping for any answers, any solutions. And we have not had a good result treating these patients, especially the long COVID patients. We have not had a good result with them either. And so the immunological impact of this, and again, just talking about vitamin D really quickly, why is the U.S., have such poor numbers with COVID? It's because, as you said earlier, we are vitamin D deficient. And part of the reason we're vitamin D deficient is because of our food. We use a lot of GMOs, genetically modified organisms, and those pesticides that come with GMOs bind vitamin D in our gut.
Mm-hmm.
Yes. And that's
Yes.
part of the reason why we have such huge vitamin D. I am vitamin D. I sell vitamin D for a living, but I am vitamin D deficient. So we all struggle because of our food contains these the pesticides, specifically Roundup, that prevent us from absorbing the right amount of vitamin D.
Yeah. Now, you raised a point which I touched on just a few days ago. In the UK, a politician, Andrew Bridgen, an MP, has been challenging the government on the risks of vaccines, vaccine harms, and he has been removed from the party for continuing to talk about what they consider is irrelevant. Okay?
Yeah.
From your clinical perspective, what are you seeing? What's happening?
Well, just now, I'll just tell you, 30 minutes ago, right before I came on with you, I had a brand new patient who came in and wanted to get a vitamin IV, and he was telling me about his mother, 76-year-old, very robust patient, or a person, I should say. He's a HVAC professional. He has his own business, and she was doing the bookkeeping in his business, and she was in pretty good health. She had some issues, but he said that within a year of getting the vaccine, and within a week of getting the vaccine, she started having severe debilitating symptoms that eventually led to her death from a pulmonary embolus. But she had quite a number of other medical issues prior to that. So she went 76 years doing very, very well, never hospitalized, some minor issues, to death within a year. And so, in my mind, there is no question that the elephant, as you so eloquently put it, is at least related. She had myocarditis. She had thromboembolic disease. These are known side effects of the elephant. And there's no doubting that. The data is clear now. We knew in the first month that those things were going to happen, just from the data that they had in their own research that was published. But for some reason, we did not acknowledge that could possibly be true, even though it was published. And now, 3 years later, we still aren't talking about it at a national level. And the news media is not doing what they're supposed to be doing in reporting this information.
And it raises an important point that I'm observing now. I recently listened to an interview with Justin Trudeau, and they are starting to acknowledge at least that they're vaccine injuries, but they're saying for the billions of doses, how many lives were saved, that can be argued about. But the problem is the perception seems to be that now that countries are pulling back, Switzerland, UK, well, not quite yet the USA, that everything is okay. But my big worry, and this is again why I keep on saying the same thing, is that if you still have circulating virus in an environment where there is some kind of immune mediated mechanism, you cannot underestimate the impact that can have. And it doesn't happen quickly. This is why it's unseen. Right. It's a real worry.
Right. It's extremely concerning. The thing that I realized, and I didn't know this at the time, I was a huge fan of Dr. Fauci, Dr. Anthony Fauci, and he's now retired. When he came on the scene in 2020, I remember I made a post on LinkedIn. If my profile was active, you could look at it, where I was like, wow, Dr. Fauci is here now. We're going to get all this resolved. He's the expert. he's the man. He and all of us, a lot of my physician colleagues, I got a lot of, I remember I got a lot of engagement on that post. And I didn't understand at the time, I just learned this in the last week, that he actually was doing research on bioterrorism, appropriately. He was funded to do that. He had a $30 billion budget to do that. But there were two other organizations in the U.S. The military had a $70 billion bioterrorism budget. And then there was another organization that also had a $40 billion budget that he was involved with. And so I didn't know that. I mean, I think most people didn't know that. And so all this lab leak stuff at the time, I think it made perfect sense that it was a lab leak. I'm not qualified to, state that. At the time I said, I think it is, but I didn't have the proof or the evidence that showed that it was. But now I think it's common knowledge, and I think they've pretty much stated that it is a lab leak. If it is a lab leak, then the work that was being done on this virus, at least in part, was as a bioterrorism weapon, because the money that was funding that research was coming from organizations that are researching bioterrorism. And so I think that would have been helpful to know at the time, and that's one of the reasons why he was the highest paid government official, because his salary was being drawn from 3 different sources.
Yeah. I don't know what we can do to unscramble this egg. And that's the challenge now,
Yeah.
because as much as I can recognize and see many of the challenges and the issues we're having now, we still need a degree of trust in our system in order to have a stable society. It's we need to, because the health systems are not just about COVID-19. There are many other diseases that they are managing. How do we unscramble this egg?
We are in very, very serious trouble with that. I think integrative practitioners like myself have had a free marketing campaign called COVID-19. People are questioning everything, as they honestly should have from the very beginning. Nobody should just assume, including the doctors. We are just automatically complying, with all these recommendations. And patients are smarter than we are in many, many ways. And they should be asking questions. And they are wondering why I'm not allowed to visit my family member who's dying, in the hospital, and why we are still wearing, literally in the last 2 weeks, we finally got the masks off at one of my hospitals. We were wearing masks. Everybody else in the whole world was not wearing masks, but the doctors and nurses, for some reason, had to continue wearing masks. And so I think we have really done a very, very huge disservice to our healthcare system in engaging the trust of our people. And I don't know if we're ever going to recover from that, because people that discover the root cause approach want that. Why wouldn't you?
Yeah, I mean, and this is the biggest challenge that I have, is that even though I know we have to speak out to challenge stuff, and even though there are risks with doing that, I think that it is incumbent that the public knows that the system is skewed in a way that allows it to be taken advantage of. And I'm trying my best to defend good clinicians across the world who have been pulled into that trap of only looking at evidence-based medicine without actually looking at the evidence themselves with a critical eye.
Yeah.
And that's something that I don't think the general public understand. The system is based on protocols.
Right. Well, they trust us. Just like we trust professionals. Like if I go to my lawyer, if I go to my accountant, I trust them. I don't know anything about law or accounting. So when they tell me that so and so is A, B, and C, I believe it. And for me to have to learn accounting to verify what they're saying is very difficult. And I think that's the unfortunate part about what's going on, is that I should say the good news is that a lot of the things that we're talking about, so vitamin D, for example, we've been talking about it a lot during this 45 minutes or so. Vitamin D is crucial to the immune system, right? So a lot of people don't know that, right? So without a normal vitamin D level, which by the way is 60 in the US, not 30, which is what most labs say. Um, you should have a level around 60 to have a robust immune function, is critical to the way your immune system works and your ability to fight off cancer, your ability to fight off viruses and bacteria, your ability to just have general good health. Your immune system is critically important to that. And a lot of people don't realize that or understand that.
And actually, I'd add into this that one very interesting thing that I observed with vitamin D is that we keep talking about the threshold for normal levels,
Yeah.
not recognizing that, say, for instance, in the UK, they'll use a cutoff of less than 50.
Yeah.
But in reality, the question is that if the top dose where you go toxic is over 400, a normal dose or a normal level would probably be about 200.
Yeah.
Our whole approach is just to prevent the scrape the individual just above the basic level.
That's right.
Rather than getting them into
Yeah.
a good therapeutic range.
Yeah.
And it's that kind of thing that, you know, a story from my point of view is I saw a patient take 50,000 units daily for almost 3 months by accident.
Yeah.
And it took 3 months before his levels went above 400. You know, it's fascinating, but you're right. These are the fundamentals of medicine. It's almost as if after all the time was spent figuring out that these vitamins were necessary, we then spent another 60 years disintegrating the narrative so people stopped taking their cod liver oil. You know, it's incredible.
Well, as an example of how bright my wife is, I mean, she is the one who said, let's do IVs, you know, and IV vitamins. And I said, why do you want to make expensive urine? You know, because that's what I was trained. That's how I was taught. I remember my attending saying that one day, you know, on our rounds. And I never looked at the data. I never looked at the evidence of, you know, for example, vitamin C in cancer. I mean, vitamin C has clear evidence in breast cancer. It has clear evidence in sepsis. I never looked at those studies. I kind of heard about them peripherally, but there are tremendous applications. And forget about that. Just go open up any biochemistry book, any medical biochemistry book, and you will see all these vitamins, the essential vitamins, in almost every single reaction that you know you learn about. And so I just don't understand how I was so dumb.
Well, actually, I saw somebody just make a comment here, and I think that this is spot on. Tell me your thoughts on this. This is from Ralph.
Yeah.
Too many specialists and not enough generalists. Well, what are your thoughts on that?
Well, Philip and I are both generalists, so we absolutely agree. You know, the truth though is that it's because of the way the system is engineered. I mean, the specialists make double, triple the money, you know, that a generalist would. So that incentive alone is driving that. And what happens when you become a specialist is you just forget. You know, you don't have the time or the energy to worry about the whole patient. You know, you're focused on the rheumatologic issue or the cardiovascular issue or the pulmonary issue. And we need those people because, you know, lots of medical diseases are extremely complicated. But I think we do need good generalists and good internists and family medicine doctors that are that have a good intuition for kind of where a patient's condition, especially when they're sick, you know, where the root cause of that issue could be. And then even a bigger, kind of another level behind that is that we need preventative people. You know, why don't we have more preventative people in our administration, in our government? You know, designing a food program, for example, like the FDA, for example, what is their job? How many preventative people do they have there that are actually making a difference and moving the needle in terms of quality and safety? We're not. You know, there's a national emergency on safety and quality that we don't even talk about anymore. You know, this 100,000 Lives campaign that was started back in 2000, 2001. We are still killing 100,000 people a day or a year. I'm sorry. You know, we've been working on this problem for 20 years, and we have not moved that needle. So why are we not talking about that as to why that is? Because a lot of people, and me myself, I mean, I've spent a lot of my own time and energy trying to reduce that number, And despite my best efforts, it didn't really change it. And the reason is that we're not delivering the right care in the first place. So if you keep changing the wrong protocol and the wrong policy and the wrong procedure to be wrong, even more wrong, or slightly less wrong, you're still going to have wrong outcomes. And I think that's a huge part of why we're not advancing.
Yeah.
What are the root causes of that?
So, in a sense, as we come towards the end, Barbara, it as we look towards the future. In a sense, I'm having the sense that this could be a good thing for medicine, because I could have seen medicine getting into this rut of struggling to find solutions for complex problems. We had become satisfied with just having a drug to treat symptoms and not explain primary pathophysiology. And COVID 19 has demonstrated that the emperor has no clothes. We need to get back to fundamentals of medicine, which is understanding disease, studying disease, coming up with solutions for disease. What would your final thoughts be
Yeah.
at this transition point for health across the world?
You hit it right on the head, Philip. I mean, yesterday on TV, I saw one of the news programs that they just released the data on this obesity drug. Yeah. So I would love to see, how well this drug does. Because in my experience, and in the last 2 or 3 years, and here at our clinics, our patients are very, very smart. I mean, they see everything. I learn so much from our patients, and so those patients would never even think about taking a drug like that. And I think it's the learning and education of our population that is going to get us to where we want to go. And I think the good thing about COVID is that a lot of people are clued in and are paying more attention. The gentleman I was speaking about earlier, the HVAC professional,
Mm.
the entrepreneur, his wife is a pharmaceutical executive that left pharma. And there are so many. I mean, even when I was there, most of my colleagues. I mean, pharma. The thing about pharma is that there are excellent, really, really smart people at the front lines. I loved all of my colleagues. That were at the front lines and kind of trying to deliver the message, and they were all well intentioned and trying to do the right thing. But I think there's another narrative that they just are not aware of, just like the rest of us. We're not aware of the Great Reset, for example. That's a higher level policy and narrative that we just are not aware of. If we were more aware of some of these things, we could understand why certain things are happening.
Yeah, yeah. Wow, wonderful. Tremendous. Great talking to you, Barbara. I mean, this is the kind of conversation that we need to have more of, because I think that the population at a large needs to understand that there are many good clinicians out there, many people who are thinking, finding real solutions, and making ways to get patients better. So thank you again, and I'm sure I'll be able to talk to you again in the future. And just, where are you based again, Barbara?
Well, I'm in
Your
Pennsylvania. Currently I'm in Doylestown, Pennsylvania, but I actually live in Bucks County. This is Bucks County.
Bucks
Good
County.
place to live. Anyone that has never been to Pennsylvania, if you come, please come and visit Bucks County. It's a great place to be.
Excellent, excellent. I'll ask you to hang on the line with me, and I'll just do this outro. Thank you, everyone, for joining us, and I hope you look forward to having another great conversation in the next few weeks. Have a good evening.